Hello, it's Peter Wright and Kathleen Beauvais with another episode of Health Declassified. And this is where we explore the truth behind health and wellness. And we do that by bringing you expert guests in various fields connected with health. Today certainly will be no exception. I'm looking forward to this one. It's going to be very interesting. But first, let's introduce co-host Kathleen. Hi, Kathleen. How are you today?
I'm doing great, Peter. Thank you so much. And thank you all so very much for tuning in to our show. We so appreciate having you. And as Peter mentioned, we do have another special guest with us today. We are so privileged to welcome Dr. Jeff Gross to the show. Hello, Dr. Jeff. How are you?
Hello, hello. Great to meet you both, and the privilege is mine.
So, Dr. Jeff is a regenerative stem cell medicine and anti-aging specialist. He's also a neurological surgeon with fellowship in spinal biomechanics, as well as an author. And today, he's here to chat with us about the stem cell approach to health and longevity. I can't wait to dig into this topic. So, Dr. Jeff, can you tell us what stem cell technology is and how it works?
Absolutely. So we'll cover the basics here for people that may have heard of stem cells or you
Mhm.
just haven't but are interested. Stem cells are the cells that create us, right? So we're an embryo and then a fetus and then we're born, and those are all stem cells that from which all of our cells stem.
Hmm.
And we are made up of our cells, and the better we take care of our cells, the less inflamed they are, the less oxidized they are, the healthier we are, and the longer we live without disease.
Mhm.
And that's called health span, which is longevity plus health. We want to be healthy throughout our lives. So learning about these stem cells and how they work and what they do for us, even when we're born and young and then adults, they help us grow and heal and repair and replace and restore. So the whole concept and the specialty of regenerative medicine is tapping back into that knowledge, which we've gained quite a bit in the last 20 years, and reapplying it as a medical strategy to achieve health desires, not just the goals, right? And that desire might be to be healthier, to help prevent disease, help have live long and healthy, and suppress inflammation. Inflammation being this sort of cellular degradation
Mm,
that portends to disease and aging.
right.
Okay. So is regenerative medicine using stem cells a sort of magic wand for all age-related chronic conditions?
No, I wouldn't say that. We don't want to over advertise
Hmm.
that, and of course we have to be cautious with any claims that are made. I'm broadcasting here from the U.S. and Kathleen's in Canada. I think they have similar laws, but we're not allowed to make any claims yet that stem cells or anything related to stem cells, which hopefully we'll explain shortly, uh, cure or treat a disease or condition, because our
Okay.
FDA in the States won't allow us to make those claims until someone they appoint to a panel decides that those claims are able to be made, even though there's wonderful medical evidence and other countries have already allowed doctors to make
Okay.
claims, particularly in Europe and Asia. So here in the States and probably Canada, we're held back.
Hmm.
We're late to this technology. It's not so much technology, it's almost natural. We're late to tapping back into our own body's innate, recovery and health intelligence.
I
Okay.
love that.
Okay.
Well said.
Yeah.
So, where do you extract the best stem cells in a person, and how are they then processed?
Yeah. So a great question. So the source of stem cell and stem cell biologics
Hmm.
are from two potential sources. One would be yourself.
Hmm.
The other would be from a donor. So yourself, you can have them harvested from your fat cells, from your bone marrow,
Hmm.
other places in the body. But I'm getting up there in my years. I'm pushing 60 this year. So my 60-year-old cells have been exposed to 6 decades of inflammatory changes and damage from the environment, from the food source, from the lack of nutrition in some cases, from electromagnetic fields, from stress. Mine aren't potentially the best. Now, that
Hmm.
doesn't mean they can't work. I'm not completely down on that. But it's a lot simpler to have it from a donor. So the donors, at least the ones we tap into, are non-COVID vaccinated mothers who are going to have a planned C-section. And, instead of throwing away, the perinatal
Yeah.
parts and fluids after the mother has a successful delivery of a baby, these things are saved and they are screened and tested for a host of diseases and viruses and things. And they are not processed. We are not allowed to manipulate these tissues at this time. So these are basically out of the box, natural. They can be concentrated or filtered or something like that, but they cannot be modified.
Interesting.
Oh,
So I got to pick up on that one. I've been a farmer for a lot of my life, and living in Africa, of course, we lived quite close to wild animals, and we followed the activities of wild animals. And in ruminants, sheep, cattle, I think pigs as well, and certainly wild gazelle, the mother would eat the afterbirth, the placenta, after the baby is
Right.
born.
Right.
We Conventional wisdom said a lot of that was for defensive purposes to remove the smell and evidence of giving birth to put off carnivores, right? Lions and particularly hyenas. But is that the whole story, or do you think that was nature's way of them using those stem cells?
I can't speak to the we'll call the teleology of that, meaning
Right.
what preserved the species better. One of those reasons could be an accident, but
Yeah.
they both make sense to me.
Hmm.
We do know there's health benefits from eating these things. In fact, you can go on the internet right now and buy capsules of placenta. I think they're
Really?
bovine or cow,
Yeah.
and you can, in some cultures, they actually cook the placenta and serve it up as a congratulatory meal to the family of the newborn. And then in some places, tribes, I think in South America, they actually save it, the placenta, and use it as a wound care
Ah,
salve.
interesting, interesting. And leading on from that, I've seen some articles that allege that some stem cells come from aborted fetuses, and that to me would raise huge ethical dilemmas. Is that just a fear that's being put out there
Yeah,
without
I mean,
foundation?
you're absolutely right, Peter. It should raise huge ethical dilemmas. I have never heard of it, seen it. I know the myth is out there, and I think
Hmm.
it's one that just is put out by big pharma and others to suppress people from looking into uh, our own natural cell technology.
Right, right.
right.
So there's no other really ethical dilemma with using donated stem cells in.
Should there be?
Should no, I'm asking the
No,
question.
I mean, no, I mean, as long as it's a healthy individual screened and tested and these donors are not paid. So this is not, people, oh, I'm going to have some more babies so I can make some money with the
Mhm.
afterbirth. No,
Sure.
it's not like that at all. These are true donations. They have to be in
Yep.
the donation system, at least here in the States. Yeah.
Okay. No, thank you.
So once you've extract these stem cells, how are they then administered? And is everyone a good candidate?
Well, not every. I'm going to take those backwards, Kathleen, if
Okay.
that's okay. Not everyone's a good candidate. We're very specific and selective about how we use them and who gets them because it's not for everyone. For example, we use them for many different things. I could make a quick list for you.
Mhm.
We do them. I mean, the low-hanging fruit is for
Hmm.
painful, inflamed joint degeneration. People who are having loss of cartilage, as bad as bone on bone.
Mhm.
Their doctor calls it arthritis, which is really
Hmm.
a dummy down word for it, but that is the process. It's an inflamed joint. And these are people facing potential joint replacement. And here in the States are hundreds of thousands of those done, every year per joint. Probably less in Canada because I think you have to wait there to see if you die first. But the
Pretty
yeah,
much.
Oh,
Yeah, there's a
a lot
couple
of
of year waiting lists for these
uh,
yeah,
procedures. Yeah, it's
and
true.
right,
a lot of Canadians come down to your country and swell the ranks
yeah,
of yours because
yeah. Well,
those who can
that
pay for it.
understood. And the that's probably we get the quickest and best results generally with applying to that. It's a direct injection, but we're very specific. We get the right MRIs and we evaluate, we make a clinical correlation. It has to be something I think I can help with. I'm not going to just do it to do it.
Mhm.
A lot of clinics will do it to do it, right? Um, we also use a lot of intravenous. So
Mm.
we do that for people who want to get help with an inflammatory issue, whether it be autoimmune, whether it be perhaps an infection that had a hyperinflammatory component, like a long COVID or a
Mhm.
Lyme's disease or something like that, or other inflammatory issues. For example, recovering from heart attack, stroke, have an inflammatory component for traumatic brain injury. We also use them for people with what they're called age-related diseases. But really,
Mhm.
if you look at age-related diseases, we're speaking to inflammatory diseases,
Mm.
Mhm.
including Alzheimer's, which has an inflammatory component, and of course, others. Even cardiovascular arteriosclerosis, the narrowing of the arteries. So these are, and then we have more specific approaches. People want to suppress inflammation just as a preventative. So we use for we'll call it longevity seekers or
Mhm.
biohackers. We have lots of those. I'm one myself, I will admit, and
Mhm.
I do an IV of these things 4 times a year just as a routine. So those are things we do. We also have a nasal spray. Children within the autism spectrum tend to have improvement by help to settle down the brain inflammation that
Yeah.
might be contributing to their attention deficits. We've seen some interesting things there. We have a breathing method of getting these into our body that involves just a standard breathing machine, something an asthmatic might use.
Mhm.
And then we even have some more specialty male and female sexual enhancement injections, things like that. We also have some cosmetic uses, skin and scalp for hair, thinning hair, and facial rejuvenation, just like what used to be called the vampire facial, which was a platelet-rich plasma from your own blood.
Mhm.
Well, now we can
Yeah.
supercharge it and forget the blood. We're going to the, even more youthful stuff. So that's what we're doing these days.
That's interesting. So how do you target? You extract the stem cells. Now, let's say someone with so-called arthritis in a knee joint, for instance. The cartilage is worn away, it's bone on bone, and they want to regrow that cartilage. How does the stem cell, when you put it in there, know that it's cartilage it wants to regrow and not enlarging an artery, for example?
So we're using stem cell signaling factors, not just stem cells. But let's
Okay.
refer to them generically since we're not allowed to go beyond 2 hours here today. The we target the location of what's called the chondrocytes. And for those listening at home, chondrocytes are the cells that form the cartilage. They formed the cartilage in the first place. This
Hmm.
was the cartilage factory, and they are living at the bone edge of the
Okay.
cartilage in what's the old growth plate.
Hmm.
So that's why this MRI targeting comes in very handy because we deliver the biologics directly to the zone where those cells are, and those cells sort of get reawakened, reactivated
Okay.
to
Okay.
start doing their job, which is to make these cartilage proteins and support the cartilage. So how do they know not to go crazy because they're basically turning on the process that created that joint and built it in the first place, which did it properly.
Hmm. Hmm. And sorry, Kathleen, I'm going to push this one a little further, if
Sure.
I may.
Yes.
Um, as a horse owner, one of the problems with certain horses when they get an injury, either a surgical incision or a wound, is you get what's called proud flesh, where you get too much regrowth. And particularly amongst black people in Africa, more so than white people, they get keloids, which is the same
Right.
thing generally down the center line of the body. So how do you tell or instruct or signal the stem cells that are rebuilding a cartilage to stop when they've got to the right point or not go too mad on it?
The same way your body figured it out when it built that part
Ah,
of your body
okay.
in the first place. It has a limit as what it can do. Otherwise, your joint would have continued growing when you were a child and growing
Yeah.
and growing and growing. You would have this very strange joint. But the body only has so much through chemotaxis, meaning cells can only signal each other so far. There's only so many cells, so
Okay.
much cartilage you
Okay.
can make.
Okay.
Yeah, it's already bioengineered. We're not trying to change it. We're trying to restore it.
Restore it. Okay. I'm with you. I'm with you. Okay. Good explanation.
So let's take the knee, for example, because that's what we've been talking about. So you inject the stem cells in a knee, but once it's injected into the person, would they not start feeling better in some way overall, especially if it's anti-inflammatory? So yes, it might help their knee, but I would think their entire body might benefit from that.
You're right, but when we deposit these specifically into the knee, you usually don't get a systemic uptake. I'm very
Okay.
specific about how we deliver them. If we did it intravenous, then yes,
Yes.
people do have, we want that anti-inflammatory code for anti-aging,
Hmm.
because then your cells can all function at their best and more optimally. You're
Okay.
correct.
And so, can you tell us some of the results that you have seen using these stem cells? I'd love to
Sure.
hear some of your stories.
Yeah, I mean, let's start with joints. Is it in any way possible for me to share my screen with you?
Yes, it
Yes.
is. Let me just
I'm going to
give
give you
you,
my example here.
um,
There, I sent a request, and we can do
there
that.
you go.
Oh, right, wonderful. Thank you so much. Okay, so here is, hopefully you can see that. This is an example
Hmm.
of a woman. She was 52 at the time, and she had some old skiing injuries and old prior arthroscopic surgery to her knees, and her knees were just getting the best of her. She had trouble wearing high heels. She had trouble walking down hills, stiff after she was sitting. And she was told, well, when you're ready, we'll do a knee replacement. And she
Hmm.
was 52, young and active. She said, I just don't feel ready for something like that. So she came to me. This was March of 2021. And we did an MRI, and the radiologist read the MRI as grade 2 to 3 chondromalacia. So let's explain that. There's a grading system of wearing down of the cartilage, and
Hmm.
that word is chondromalacia, and that's the process of osteoarthritis.
Hmm.
And eventually, when you're out of cartilage, it's called bone on bone, which would be the highest grade or grade 4, and grade 0 would be normal.
Hmm.
So she was in the mid range, grade 2 to 3, and then grade 2 of the patella or the kneecap. So there's a side view here um, of the um, of the knee, and I will zoom in a little bit. Whoops, pardon me. And this is the kneecap to the left,
Hmm.
and the blue arrow is supposed to be showing us this gray reverse J, and that's the cartilage behind our kneecap.
Ah, right. Okay.
Okay.
And I'm showing you that because in June of that year of 2021, I injected stem cell signaling factors into her bone because that's where the chondrocytes are. And this was a well demonstrated technique from a professor in France by the name of Dr. Hernigou. And he's the one who proved that injecting the bone is superior to injecting the cartilage because the cartilage has very few cells. The cartilage is
Yeah.
biological rubber; it's hardly alive. It's the thing wearing away. So if you want to improve the cartilage, you have to inject the cells that make it in the bone.
Ah,
So he proved that. So I simply followed his excellent results. So I injected the bone edges here, and then she did quite well. And it was so again, June was the injection, and about a year and 4 months later, after the injection, she was doing fantastic. And I said, I need some before and afters. Would you mind doing an MRI? She said, yeah, I'd love to see it too. I'm curious. So we did an MRI. We did not speak to the radiologist. We just said knee pain, even though she was feeling better. And the radiologist read this as mild cartilage irregularity with mild thinning. They didn't even grade
Wow.
it.
Oh
So
my.
I said, okay, at worst, it's a grade 1. She went from a grade 2 to 3 to a 1. And now you can look at the MRI from 2022 and look how thick that
Yeah.
reverse J is. Now, that's the cartilage. See, it went from this thickness
Yeah.
to this thickness. So she got a nice, thick, and juicy restoration of her knee cartilage there. So that's an example I love to show because it's one of the earlier ones we did. Now, you see up here it says after intraosseous exosomes, and we haven't talked about that word today. And I keep alluding to these signaling factors and
Hmm.
stem cell biologics. So we've skipped ahead from stem cells. Stem
Okay.
cells, if we put them in you, Peter and Kathleen, they're gone in 10 to 14 days, but
Ah,
their benefits last well beyond that.
right.
And if you took a placenta and put it in powder and put it in capsules, the cells are dead.
Yeah.
They're gone. But there's some type of healing benefit that is translated to you when you use that material. So what is that? Why are those stem cells leaving a benefit after they're gone? Well, it turns out those stem cells deliver the message to our cells. Our cells do the work. And they
Okay.
deliver it through a series of growth factors and small vesicles called exosomes is kind of the buzzword for this. So these are stem cell derived exosomes, and we like them in some ways better than stem cells because they do the work of stem cells at a fraction of the cost. They
Mhm.
travel better through the body, and they don't have anybody's DNA in them. Not that that is an issue necessarily, but some people are concerned about it.
Hmm. 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 Okay. Interesting. How do you get those exosomes out of a stem cell donation material?
Well, it turns out they are incredibly abundant in amniotic fluid. So the donors
Okay.
have plenty of amniotic fluid, right? Sometimes measured in liters,
Yeah.
and that is sent to these FDA certified and compliant labs in the States. The
Mhm.
labs then screen it, test it, concentrate it, filter it, because there's some stuff you don't want in there, and
Sure.
then make it available to clinics like me, kind of an end user. So I basically purchase it and make it available to people who want to try something other than surgery or pharmaceuticals.
Wow.
And
Amazing.
you mentioned that you can get capsules, like bovine capsules. Um,
I've seen it on the internet, but I think what we should talk about here is there are other source of stem cell derived exosomes in our world.
right.
Hmm.
Let's list them. Um, Bone marrow, which you can
Hmm.
eat. Bone broth.
Hmm.
Why did our grandmothers make us chicken soup when we're sick? Because it comes from the chicken, stock is from the bones of the chicken that has stem cells and exosomes in them. How about colostrum, mother's milk?
Yeah.
Plenty of exosomes. And then what you may not know is that plants
Hmm.
uh, make exosomes, and those exosomes are actually communicate with the cells in our body, and that's probably how we get the most of our phytonutrients. You look at
Okay.
resveratrol and quercetin and
Hmm.
fisetin and all kinds of things that sulforaphane, glutathione. You know, it's very difficult to take these nutrients, break them down, and put them in a capsule, and then eat the capsule and hope you absorb it, get it in your bloodstream, and get it into your cells and into your mitochondria. I mean, it's very difficult. But if you have them already in an exosome form, which is nature's liposome,
Yeah.
it goes right into your cells. So we have also a plant-derived exosome supplement from curated organic Italian fruits for anti-aging properties. So that's something we've launched a few months ago. We've been working on for quite some time.
Interesting. And quick one, bone is hard, and I accept that the end of the bone, the growth plate where the cartilage is going to be formed, may be softer, but it still sounds like quite an invasive process to inject something directly into the bone. Is it painful, or does it require some sort of drill?
Well, yes, but Peter, you have to compare that to the invasion of a knee replacement.
Yeah.
Yeah,
So,
well, I agree. No, I agree. No,
so,
no,
so
I'm not knocking it.
yeah, we do sedate people, and then there is a little bone needle and drill situation, but no one feels it because they are, mumbling about a trip to Tahiti during that
Yeah.
process. Yeah. Mhm.
Okay. I just wondered. The mechanical side of me said, "How do you inject into bone?"
Yeah,
Okay, got
it's
it, got
well,
it.
and as you know, I'm a surgeon, so a simple bone injection is, you know, no big deal.
Sure.
For me, of course, for a patient, it can be a big deal, but we do make it a pleasant experience.
Okay, no, that's fine. So here's one for you. I've been watching a program on Prime, I think it is, called Super Vet, about this Irish vet in the UK who is referral only, and mainly pets and dogs, but also rabbits and tortoises get sent to him when other vets say they need to be put down, right? And he does some amazing work with animals on implanting an artificial paw or an elbow or whatever, and he uses bone marrow to grow new tissue around the bone. And it seems in some ways they may be doing more advanced work on animals than they are on humans. And I guess there's some ethical answers to that question. What's the future? Where are we going? Where's this technology and these treatments going?
Yeah. Well, I mean, you're right about the veterinary side. I mean, a lot of the good stem cell research came from thoroughbred horse
Yep,
work because people invest in those horses. They do whatever. And some of
that's
the
right.
early patients, the adopters of stem cell, at least in the States, were ranchers and rodeo participants because
Yep.
they saw the horses getting this great result. But we have, we're talking about stem cells 101 here today on your
Mhm.
broadcast. We actually have some designer specialized exosomes from natural killer cells that we can help people with cancer. There are more designer exosomes coming. There are even more specialized stem cells like Muse cells that are coming down the pike that have even more benefits to all the different lineages of the embryo tissues, which can expand beyond what we currently have available. And the cutting edge research is in what's called pluripotent stem cells, where you sort of induce these back into an embryonic state to help maybe regrow a finger, regrow a limb. I mean, that's not far-fetched anymore.
And
Wow.
you know what? I'm listening to you speak and I'm thinking, my goodness, where could, the people that are quadriplegic, any paralysis, spinal paralysis, what this could possibly mean for those patients.
Yeah.
This is exciting stuff that you're involved with here. This is
Yeah.
amazing. Absolutely. So, just on that topic of paralysis, where do you think this is going? I mean, I'm sure you must have had inquiries, a lot of
Of course.
inquiries from.
Yeah. Well, there's some early work out of China, and they tend to be leading the charge on trying some cool and interesting things, where they
Mhm.
took some spinal cord injured patients who were paraplegic, and they actually did a surgery. So it does require surgery. They removed some scar tissue in the spinal cord from the injury, which
Mhm.
apparently was the key to this. Then implanted some stem cells and had some return of function. So we now have, I'll call it a paradigm, a way to study this further and see, what is needed and how we can get that kind of recovery regeneration done in the spinal cord. Because you're absolutely right. That would be amazing.
Wow, wow, wow. Because getting back to animals for a moment, there's a type of lizard called a skink, which we knew in Africa, which will shed its tail or have its tail taken off by a predator and grow a new tail, nerves, everything intact, and that tail will move just like the original, right?
Yeah.
So the animal kingdom is part the way there already, isn't it?
Yeah, we have that in other species as well that you've noticed. Other lizards, they have the axolotl that can regrow a whole limb,
Hmm.
which is sort of this semi-amphibious creature sort of left over from evolution because it got geographically isolated. You've got starfish can regrow a limb, and a human child up to the age of 5 or 6 can regrow a limb, sorry, a fingertip if it is beyond the last joint.
Okay.
And then as we age, those genes get turned off. So as we learn to turn them back on, we're on
Hmm.
to something. Yeah,
Ah, right,
Wow.
right, right.
Now, you mentioned
Ah.
something about cancer. Can you just speak to us about that for a moment?
absolutely. So one of the things as a physician, we always want to do is help people with this horrible disease where your
Mhm.
body turns against you in such a
Mhm.
way.
Mhm.
So I had always been looking for something since I'm in regenerative medicine now that could help with cancer because regular stem cells don't seem to have quite the benefit we're looking for. And there's some question marks about that. But there's a subset of cells in our body called natural killer cells,
Hmm.
NK cells. They're a very small percentage of our white blood cells, the immune system. And their job during our lifetime is to go throughout our body and remove abnormal cells. They're like a little private security system that we have. And they do so by emanating their own natural killer cell exosomes or signaling factors. And they are very selective. They don't hurt our normal cells, but they will remove cancer cells. They will remove infected cells. They will remove uh, something called senescent cells, which are
Hmm.
these just aged, boggy cells taking up resources but not contributing to the community. And for fun, we call those zombie cells. You may have heard that before.
Yeah.
Right.
So, as we age, though, our stem cell populations and our immune cell populations become exhausted and not as useful. And what happens is we can't remove those accidental cancer cells as well, and then some can actually set up shop and form a
Ah,
cancer
okay.
tumor. So if you look at people who have cancer, their natural killer cell function is diminished and their natural killer cell numbers are diminished compared to healthy individuals. Well, wow, what if we could enhance their immune system by giving that back?
Yeah. Yeah.
So that's what we're doing. We now have access, and it was very difficult to get natural killer cell derived exosomes and off the shelf augmentative assistance for people with cancer. Maybe you're at risk, you want to help prevent. Maybe you're in remission, you want to enhance that remission. Maybe you want to do it in between traditional therapies, chemotherapy, radiation, or some people say, well, I'm not touching chemotherapy, it's
Mhm.
poison. I want to
Mhm.
do something natural and different. So we make it available to them.
Okay.
Oh my
Interesting.
gosh.
Wow, that is
You
very interesting.
you must have people contacting you from all over the world.
We do have international folks, and we do a lot of remote video, meetings and consultations, and like we're doing here today. But
Right.
we only invite people here to Las Vegas if they are a candidate for this. We want to be selective.
Sure.
Sure.
Here's one for you that concerns me a little bit, and I don't think I'm a conspiracy theorist. How acceptable is the pioneering work you're doing, as I gather an independent, to the established big pharmaceutical companies, or
Hmm.
are they also trying to pursue this one as well?
They are trying to pursue this as well. But are they happy with this? Not at the moment, no. I'm surprised I haven't found myself buried in the desert here in Nevada. But yeah, no, you're not a conspiracy theorist. This is the real deal.
Yeah.
Yeah.
Okay. That did worry me a little bit. Back
Yeah.
to you, Kathleen.
Yeah.
We're getting
It
out of
wor
time.
right. I'm sorry. Yes, but it does worry me as well because I
For sure.
just want your protection and because I think
Thank you.
this is such important work. My
Yeah.
goodness.
Thank
Yes,
you.
we are running out of time, Dr. Jeff, but oh my gosh, we would love to have you back on the show because I think
Anytime.
we've
This is
just skimmed the surface of
yeah. This
what
is
this topic is all about. And
fascinating.
yeah, absolutely fascinating. But thank you so much for
Thank
being on
you.
our show today. And thank you all once again for tuning in to our show and to you, Peter.
Well, I don't want to rain on your parade, but you've got another question to
Oh,
ask
I
Dr.
certainly
Jeff.
do. Oh my goodness, an important. See, I'm all wrapped up in this topic. I forgot to ask
Yeah.
a very important question, Dr. Jeff, and that is, how do people contact you?
Thank you so much. Well, we rebranded our business called Re-Celebrate because you're celebrating the
Yeah.
renewal of your cells in one way or another. And that's ReCellEbrate. And as far as I know, we're the only people using that word on the internet. So
Yeah.
if that's our website
Re-celebrate.
address, it's our Instagram, it's our LinkedIn, it's our everything. Just look for Re-Celebrate and reach
Okay.
out to us. We like to meet new people and see if you have something we can work on together.
And just for our audio listeners, that'll be .com suffix.
Oh, correct. Yes. If you type it in, though, if you just Google that word or use it,
Okay.
whatever search engine, you can't not help but find. I think we cornered the internet on that word, no matter how you use it.
Excellent. And then you've got a book as well, I believe.
We are almost done with our book called Get Young Again. Well, I think we were going to try to call it Young Again, but someone may have beat me to that title. And it's really a how-to anti-aging from simple to the deep nerd version of it, from everything from phytonutrients to sleep to breathing to exercise to stem cells and exosomes. It'll be right in there.
Okay. And when have you got a date for publication yet?
I don't yet. As you can tell, I get bogged down with things I really love doing, like treating patients. So I probably need to take a few weeks off to get it finished, but it's pretty close.
Okay. Oh, that's good to hear. And we'll certainly give it a push. Every week in our newsletter, we have a featured author who's always one of our previous guests. So when your book's published, we'll slot you in there. So from my side, wow, this has been absolutely fascinating. And
Really.
I think listening to this or watching this episode will give a lot of people a lot of hope for some relief to their symptoms. So thank you for that.
Yeah,
And that's it from me. Thanks everyone for watching. Jeff, thank you so much for coming on the show. Back to you,
my pleasure.
Kathleen.
Thank you once again for tuning in, and until next time, take care, everyone. Bye-bye.
Bye.